Welcome to the Fabulous Lifestyle Radio Show, where we talk about food, fashion, finance, and foundations of life. We are live on KCAA Broadcasting Network, 10:50 a.m., following broadcasts in 102.3 FM and 106.5 FM. We are serving the world one household at a time. KCAA is affiliated with CNBC, NBC News, and NBC Sports. We are sponsored by Sheltered Studios, Fire Connect, and Yeater Peak Performance Coaching.
Welcome back to KCAA Radio. We're live here in Redlands, California. This is Kim Yeater, host of the Fabulous Lifestyle Radio Show. Foundation segment, Faith, Family, and Fitness, Mind, Body, Soul Transformation. You just had the opportunity to hear Anne-Marie Nye, and thank you, Anne-Marie, for being with us. Absolute blessing. And next up, we have Dr. Marilyn Singleton. Dr. Marilyn Singleton, are you in the house with us?
Thank you for having me today.
I'm so honored to be in your presence again. I got to share with our audience a little bit about you. Dr. Singleton is a board-certified anesthesiologist and immediate past president of the Association of American Physicians and Surgeons. She was a faculty at Johns Hopkins in Baltimore, Maryland. We could share so much about this woman. She is an absolute powerhouse. Dr. Singleton has published numerous articles, given presentations on healthy policy, and had many radio and television appearances. She started a blood pressure screening clinic at her church and makeshift clinics in 2 rural villages in El Salvador. Dr. Singleton ran for Congress in 2012. She has helped thousands of patients, giving them wisdom and insight. Dr. Marilyn, welcome.
Well, what do you have for your audience today?
Well, I'll tell you, we're bringing it. And I know because of your experience, you have so much wisdom. And I want us to take a jaunt down the road of faith, family, and fitness, mind, body, soul transformation. From your professional perspective, give us a little bit of the lowdown. What's important for you, and when it comes to faith, what's important for you, and how you see that translating into your patients, and the importance of faith for them?
I think the first thing you have to look at is when you meet a patient and are taking care of a patient, that they always come first. So you have to find out where the patient is coming from. And when you talk about faith, we all may be of different religions, but so many people have a spirituality that actually tends to come out when they're sick. As an anesthesiologist and someone doing ICU care, that you see the patients at their most vulnerable, and that's where I do think faith comes in so handy, I might say, because sometimes the patient has nothing else to grasp, and that's where you can be a facilitator. I'm not a preacher, I'm not their minister, but you can certainly let them know that it's okay to rely on spirituality.
Okay, here's what I'm hearing so loud and clear. The importance of meeting people where they are at. That's what you do on a professional level, and I get on a personal level. If we can just take that, right, and be a space of facilitation, that is so powerful. Faith really does play a key role. So good. We're going to transition over, and we're going to talk a little bit about family, because, I believe there's a connection with faith, family, and fitness, mind, body, soul transformation. So let's talk a little bit now about what your experience has been with patients when it comes to family for them, the importance of having family in their lives, the importance of even in your own personal life, Dr. Singleton. What's the importance of family for you?
Oh, my goodness. I don't know where any of us would be without family. And just let me say, family does not mean somebody who you have a blood relationship to. And I think this is very important to point out, that we can sometimes find our own family, and sometimes the ties with dear people who we are not blood related to can be stronger depending on what the family dynamic is. And again, this is something we notice in medicine, and I see it in the ICU and when people are sick and in these troubled times, that they draw on a variety of people, and we have to accept that. One of the biggest changes I love seeing was in the ICU. It used to be only immediate family members could visit, and then it opened up, because sometimes the immediate family member might be who's toxic to that patient. So we have to be broad in our definition of family, and there's no question that it can help pull people through to know that there's somebody out there who truly loves them and who wants them to get better. And this is what patients need. This is what all of us need, even when it's the smallest thing. And certainly in life, I've gone through big things, try to get through medical school, residency, jobs, and working, 60 and 70 hours a week or whatever. And without someone to lean on, sometimes I wonder, could I have ever done it? And most everyone I know knows that there's someone they need to lean on.
Someone to lean on. Gosh, I love how you just said, in the ICUs, when they opened it up to having, the family or those people that are important to them, you saw that people were able to pull through. Gosh, Dr. Marilyn, can you imagine what's possible with what's going on in our world right now if they allow family to come into these situations where people are ill, like in a protected way? What can happen? Because we know the power of one another, the importance in our mind and in our body's healing.
Absolutely. And unfortunately, too many times it gets dismissed. I am a scientist as much as you want to be, but you realize that there's a whole nother side to science, and I think that's why they call medicine an art, and it's called the practice of the art of medicine, because you want to take it all in. And yes, you're looking at the science as you're thinking, what's wrong with this person? How can I treat this person? What drug can I use, etc. But then you think, okay, how does this fit in to how this patient is, how this patient feels? And I don't mean medically, but in their heart. And you try to pull it all together. And that, of course, is the hardest part, is pulling it all together.
Yes. So I love it. Medicine is an art, and the importance is really getting in touch with the patients of how do they feel and what do they need and what's really going to support them. And in your experience, Faith, your experience is integrating that at the right time, speaking their language, getting down onto their level, meeting them where they're at. And then it's, getting in touch with how they feel, knowing how to meet that need, allowing them the space to be able to express that. And if they're like, I want my mom in the room, figure out a way to make that happen. Okay, so we're going to transition right now. We're going to go right into the power of fitness, mind, body, soul, wellness. All right, doctor, give me the news. Give me the news. What do we got going on in that arena? What's the importance of that?
Oh, goodness. One of the best things, again, relating this to surgery that happens when people come to surgery, they suddenly start thinking about their overall health, and sometimes in 2 weeks try to get themselves together and stop smoking, get out there, start walking, and doing things. And one of your other guests had mentioned that some of this fell apart when COVID kept people inside, and sadly, I think what they needed was to be outside, not stuck inside.
I agree.
And getting sunshine and vitamin D, and then not to mention just breathing in some fresh air and seeing other human beings, that's psychologically healthy. But there's no question that our overall health enhances our immunity. It enhances our mental well-being. I'm sure so many people come back from a walk that they didn't want to go on in the first place. Oh, do I have to? And come back feeling
We've all been there, haven't we, Dr. Marilyn? We've all been there. I am not feeling it right now. Okay, Kim, hang on a second. Do not live by your feelings. You said you were going to go walk. And boy, how we feel afterwards. Is it not so empowered?
It truly is. And there's an old saying in psychology that sometimes when you're feeling low, action precedes motivation. And
So
I'll
good.
tell you, that really works. If you don't feel like doing it, just do it anyway, and you feel so much better afterwards.
Just do it. Okay, now that is key. So, all right, great. We can get walks in. We can live preventatively because like you said, it ends up that someone's 2 weeks out pre-op and they're like, uh-oh, I've been smoking. Maybe I should stop smoking. That's when they start thinking of the impact of the choices they've made, right? But what you're saying is we have the opportunity to really live preventatively. That if we live preventatively today, we have an opportunity to have our health back, to have our fitness, our mind, body, soul wellness well.
You're so right, and there's enough studies that show it's never too late. And you've said that all day today in different arenas, and it's the same is true about health and lung health, heart health, that it's never too late to start.
Oh my gosh, Dr. Singleton, it's so funny because you're like wrapping it up. I think that is the key ingredient here when it comes to family, when it comes to faith, when it comes to fitness, mind, body, and soul. It is never too late, never too late. If you're just building on that faith, set some time in your calendar, build on a time to connect with your creator. If you're building on family and there's some tough talks that need to be had, take 100% responsibility for what's yours. Go have that talks, create something new. And if it's fitness, mind, body, and soul, then start filling yourself with the good things. Get rid of the stinking thinking. Put the good things in your mind. Dr. Marilyn, we have the opportunity to live a really good life, even in the midst of adversity, don't we?
Absolutely. And I just think it's so important to believe in yourself and never let anybody tell you you can't do it. And along so many lines, whether it's personal, academic, whatever it may be, just never let them tell you that you can't do it.
Dr. Marilyn Singleton, it is an honor to have had you here with me again. We're going to have you back. It is a blessing. I love you, lady, and we will see you again very, very soon. And guys, you heard Dr. Marilyn today. Take action. No matter what, just do it. And you are here with us at the Fabulous Lifestyle Radio Show. Food, fashion, finance, and today it is foundation, faith, family, and fitness, mind, body, soul transformation. This is your host, peak performance coach, Kim Yeater. We're going to be back in just a few minutes with you.
We are live on KCAA Broadcasting Network, 10:50 a.m., following broadcasts in 102.3 FM and 106.5 FM. We are serving over 5 million households in the Inland Empire, North County, San Diego, Orange County, and San Gabriel Valley. We are serving the world one household at a time. We are also in iHeart, Spotify, Tiki Live, Ustream, Apple, iTunes, and anywhere with your favorite podcast. KCAA is affiliated with CNBC, NBC News, and NBC Sports. We are sponsored by Sheltered Studios, Fire Up Connect, and Kim Yeater Peak Performance Coaching.